Right, hello, my name is Chloe Newton, and this is my extra credit assignment for presenting an ethical dilemma using the ethical decision-making model. So to begin with the critical incident, the first part of the ethics case analysis model, the scenario I researched involves a 17-year-old Cassandra, a cancer patient diagnosed with Hodgkin's lymphoma who refused to continue receiving chemotherapy to treat her condition. So the main dilemma presented in this case lies in the conflict between the ethical principles of autonomy and beneficence. So moving on to the next part of the ethics case analysis model, which encompasses ethical principles or concepts. In regard to autonomy, or Cassandra's freedom to choose and make decisions for herself, she legally was not able to make a definitive healthcare decision, seeing that she was only a minor. She was 17 years old. This meant that Cassandra's legal guardian, which was her mother in this case, had the legal authority to make a healthcare decision for her. So in respect of Cassandra's autonomy, the mother actually upheld the daughter's refusal to undergo the chemotherapy treatment. And so this then and the chemotherapy treatment actually shows very high chances, 85% of the time, of being a life-saving treatment. So it was interesting that the mother decided to comply with Cassandra's refusal to go ahead and do the treatment. So this then brings to question the ethical principle of beneficence, or a duty to do good. In this scenario, the physician on the case's duty to make sure that Cassandra's benefits were maximized and harm was minimized. So I've touched on the ethical principles presented in this dilemma, and now I'll delve into some of the historical context and mention of the key stakeholders in the case. So we already know that most of the historical context, and that Cassandra is a minor who's diagnosed with Hodgkin's lymphoma. She refuses to undergo chemotherapy to treat her condition, and her mother, who has legal authority of her healthcare decisions, has complied with Cassandra's wishes. But to continue with this dilemma, the doctor and hospital did not want to comply with Cassandra or her mother's decision. So this case was actually brought to court, and it was ruled that Cassandra would continue to undergo the chemotherapy treatment against her will. And so all the relevant stakeholders involved, this would be Cassandra and her mother, or any other close family or friends, the doctor, the hospital, the child welfare agency, which I'll talk about really soon, and the courts. So the bulk of this ethical dilemma lies in the organizational and legal issues portion of this decision-making model. So the doctor and hospital involved with Cassandra's case decided to involve the courts to force the chemotherapy on Cassandra, based on the medical judgment that there was an 85% chance of surviving Hodgkin's by treating it with chemotherapy. Despite Cassandra's lawyers, which sought to have her considered as a mature minor, which would actually grant her the freedom of making a healthcare decision on her own, the courts ended up siding with the doctor in the hospital, and they eventually took Cassandra into custody and started her on treatment. So I learned that courts do have the authority to do this and to overrule parents that have the ability to make decisions for minors when the medical decision would be threatening the life of their children. So in cases like this one, like Cassandra's, temporary custody was taken away from her mom so that the medical decision could be made for the minor from the court system. So with this being said, Cassandra was soon confined to the Connecticut Children's Medical Center, where many issues occurred. And these are like the organizational issues. So for starters, to start her treatment, it involved a surgery in which a chest port was installed, and this is where her drugs would be administered. And so, I mean, can you even imagine being forced into a surgery That must have been really scary for her and kind of really detrimental for her well-being. Her phone was taken from her, so, for a teenage girl, that's, being cut off from communication is not okay. And also the phone in her hospital room was removed, so she had no outside communication. The only communication she had was her mother being able to visit in the hospital room with a child welfare worker present, so they didn't even get any alone time with each other. The Connecticut Department of Children and Families had Cassandra placed into foster care for the continuation of her treatment until her formal court date was set. And Cassandra even stated that she was strapped to the bed by her wrists and ankles and sedated at some point when she was receiving her treatments. So her overall experience with the different organizations and with the legal system was very traumatic. So moving into the resolution portion of the decision-making model, I thought it might be reasonable to introduce some sort of psychiatric intervention for Cassandra and her mother, as this might be very insightful in helping them assess different options, or maybe even perspectives on going through with the chemotherapy, because the chances of survival are very high, and it seems unlikely that a 17-year-old wouldn't want any chance at living. So a pro of this could be that the intervention helps, and then both ethical principles of autonomy and beneficence would be upheld. On the contrary, if this didn't sway her decision, she would be forced to undergo the treatment and everything would still end up happening. A pro that could stem from her being forced into treatment, which would be unlikely, but it still could be an option, is that she would end up appreciating the doctor and the hospital and thanking them for involving the court in saving her life, or she could just end up resenting them altogether, and the whole ordeal would have caused a lot of psychological stress on her, seeing that she was placed into foster care, sedated, and strapped down against her will. The only other option I can think of would be for the hospital to comply with her wishes or to undergo any kind of alternative treatment if she were to comply that didn't have as good of survival rates. In this case, autonomy would be upheld, but the doctor's duty to beneficence would be compromised. This could ruin the doctor's reputation among colleagues and potential clients, or it could even lead to the mother resenting stakeholders and blaming the doctor for not doing everything they could for Cassandra. So after assessing these resolutions, the disposition that I've come to a consensus on would be to offer any kind of alternative treatments for Cassandra, which would still be a doctor's way of upholding beneficence, maybe not doing the best that they could, which would be to administer the chemotherapy, but they're still doing something, and this would allow for Cassandra to make a choice on her own, seeing that her mother would most likely comply with whatever decision is made, which again portrays autonomy. If alternative solutions and the use of a psychological intervention to sway their options didn't work, then as much as the doctor and hospital may hate it, I believe that since Cassandra is very close to being 18 years old, she would, it would make sense that she can make a sound decision for what she wants as an individual, because the things that happened to her were quite dehumanizing and were probably really hard for her to bounce back from. So those who forced the treatment on her should have been more morally bound to question the means required to take the actions that they did take. Alrighty, so thank you for watching my stance on an ethical dilemma while using the ethical case analysis model as a guide.